Preeclampsia is a condition which is manifested in abnormal protein levels in the urine and hypertension. Left undiagnosed, preeclampsia will develop into full-blown eclampsia, which is extremely deadly, killing nearly 1 million women and 500,000 infants worldwide. These deaths could be prevented by a single blood pressure screening, something undoubtedly you and I have gotten checked countless times in our lifetimes. In developing countries, healthcare is not readily available. Where there are modern clinics, they are crowded and inefficient. In rural areas, the problem is worsened by the altogether lack of clinics.
In these developing countries, what would happen is a simple test that would cost maybe $1 or $2 in the U.S. is way too expensive. It could be a whole week's salary or even more of a family.
In fall of 2010, a group of Johns Hopkins engineers partnered with DSIC, an international nonprofit organization which focuses on maternal health, to address the issue of screening for preeclampsia-related hypertension. The goal was to streamline the design for the field, make it convenient for volunteers with little training to use, and engineer it for mass manufacturing. Thus, the Hypertension Detector was born. We will work in a pilot program with DSIC to train existing volunteers to work in and around their native communities with our device. Healthcare volunteers will learn how to work with expecting mothers in sensitive situations.
In order to keep our device cost-effective, we have designed the device to be largely modular. The device utilizes a blood pressure cuff which is fairly cheap, and a ball with a leak valve, and our custom device which will tell us if the patient is hypertensive or not. There are only 3 steps that the volunteer needs to take in order to use this device. So first, the volunteer puts the cuff around the patient's arm. Step 2 is to simply push the button on top of the device to start up the sequence. Step 3 will be for the volunteer to pump up the device until the lights on the device go down. The device is now detecting the pulse of the patient and outputting it. And once it's done, it will tell you whether the patient is healthy. This means that the patient is healthy.
We will advise women who are screened positive for preeclampsia to visit the local clinic and receive further testing. This will save time on the part of pregnant women and their families, and it will cut down on inefficient use of medical resources.